Hi, I'm Nicky, and today I'm going to teach you the difference between a heart attack and a cardiac arrest. So if you're going to have a heart attack, what happens over the years is when you begin to eat bad foods like fatty foods or lots of sugar, it begins to accumulate or build up inside your arteries. Arteries are the ones that take blood away from your heart, so A for away, A for arteries. That has the red blood in it, which is oxygenated blood. So if you should cut yourself on an artery, that's going to be the one that is going to be pumping out really fast. If it goes around your body through a little capillary bed and then it comes back round to your heart, and they are now your veins. So if you look at your veins here on your wrist, you'll see that they're a darker colour. That means that your blood has no oxygen in it anymore and it is now deoxygenated blood. Okay, so you cut yourself on a vein, it still will bleed, but it won't come out so fast. So you're eating all these bad foods. Over a period of years, plaque will start to build up inside the arteries of your heart. So I'm going to show you here, see how it builds up? And I can just show you here with the diagram. It builds up on the inside of your arteries here, or it can break off a little bit and move along and cause a little clot, okay? So I'm just going to show you by a diagram here. This is magnified. These are your arteries. And as you begin to eat food, it begins to build up on the inside of your arteries. More and more of this fat. So you can see it's going to be difficult for the blood flow to get past and through that. So eventually it becomes quite narrow and can be very small like that for the blood flow to go through. A bit like having a milkshake where you might suck up, has ice cream in it, and you suck it up the straw and the ice cream gets a little bit stuck in the straw, so you're sucking away. It was still very difficult, but it will let the blood flow, or the milkshake in this instance, go through. So what can happen for the person that has a heart attack is they can begin to show signs of shortness of breath, chest pain, even it can radiate up into your jaw and down your left arm more so, but it can be your right, and you even can have tingling in your hands and fingers. That's a sign that you're having a heart attack and you need to get someone to take you urgently to the hospital. You can either have lower or upper abdominal pain, or even lower back pain, so that's a wee bit more difficult to discern if you're having a heart attack. Okay, so a child around, a young child, a baby, definitely a baby up to the ages, 6 or even older, cannot have a heart attack because they haven't eaten like this, and it hasn't had, well, they may have been eating like that, but it hasn't had a chance to build up yet in their arteries. Okay, so if they have had a heart attack and they've fallen on the floor, I'm going to show you this. They will have this rhythm. Not that we're going to know, but if we put a defib on them, which is now this, you've heard of an AED, which stands for automated external, because we're going to put the defib on the outside of your body, defibrillator. Okay, so the arteriosclerosis I was talking about before, that builds up, that's in your arteries. Arterio means artery, and sclerosis means the hardening of it, okay? So when you have a heart attack, you fall on the ground, it will be a flat line. You won't know that obviously, but when the defib that we put on them, that will be looking for the heart rhythm. Now, as you know on TV, you often see this and they will shock on the flat line. That is not real, okay? It's not what will really happen in real life. What that defib will shock on is a cardiac arrest, which may come up with your heart rhythm now going into ventricular fibrillation, okay? So,
there's a black pen there. Oh.
In our heart, we have a little node called a SA node, and then down the bottom of your heart is the AV node, and that sends electrical impulses down to the AV node, just to tell you that your heart is pumping. Okay, so it's just a normal pacemaker. We sit here watching TV, or you're watching me, you're not telling your heart to beat, it just does it automatically. That SA node is telling your heart, sending pulses down to the AV to make your heart beat. Now, if someone has a cardiac arrest, and this can be a child from the ages of 0 right through to 150, that could have happened through drowning, maybe through an electrocution, or even maybe high blood pressure, or even if you maybe take drugs. Okay, so that's different from a heart attack. And if you fell on the ground and needed CPR for that as well, then the AED will be put on them, the defib, and if it picks up that, it will shock on this rhythm, okay? It's not going to shock on this, like TV shows. and it won't put it back into the normal rhythm, which is called sinus rhythm. Okay, that's what we all should be doing now, having a sinus rhythm, hopefully about 72 beats per minute. It's going to shock and put them back into this rhythm. And then, a bit like calibrating your cell phones again, to reset it. And then it will kick back into normal rhythm, okay? Whether or not you need to do the CPR to do that. Now, CPR stands for cardio, which is your heart. P stands for pulmonary, which is your lungs, okay? So when you do the breaths, 2 breaths into the lungs, it gets the oxygen into it, back into the bloodstream, back to your brain. 4 to 6 minutes you've got before the brain cells start to die off, so you need to get in fast to help that person, okay? And R stands for resuscitation, which is you're their life support machine really now, doing it for them, okay? Because they're not breathing. So that's the difference. I hope that makes sense. So a heart attack is the diet, okay? And a cardiac arrest is to do with an electrical disturbance. So thank you for listening. I'm just going to introduce you to my staff because they're able to come today. We're keeping them in a little bubble. So first of all, I'd like to introduce you to Fantastic Philip over here. Fantastic Philip. He's one of our staff members from South Africa. So hi Philip, thank you for coming. Then we've got Techno Thomas. Techno Thomas, he's the one that's really good with our techno things and our problems and issues. We just come to him and he can help us. So thanks for that, Thomas. And then we've got Cheerful Sharita. She's one of the registered nurses here. And she's into her fitness and she's a lovely nurse. Then we've got Jovial Jessica, who's very helpful. And she's been doing flu vaccinations, as you can see there. And then we've got Terrific Tracy. She's here as well. Thanks for coming, Tracy. She likes her crocheting and knitting, and she's also from South Africa. And then we've got my boss, Delightful Donna, who helps and does everything. So nice to have you here, Donna, with us. So thank you all for attending this teaching today, and I hope you've all learnt something. And signing off. So thanks all for coming. And take care, everyone, and keep safe. Bye for now.